Hello and welcome to Opt to Thrive, episode 23. To supplement or not to supplement? That is the question.
Welcome to Opt to Thrive, your go-to podcast for women's wellness in midlife, designed to educate, support, and inspire you to live your very best life. And now your host, Dr. Karina Sims.
So, it has been a bit of a scorcher here in South Australia. It's going to be another week of really, really hot weather. I'm again coming to you from the coffee nook in the house. I'm thinking it's pretty cool in here. I've just set up and left everything in here and I don't mind it. At some stage, I'm gonna move back out to the sunroom when I can, but I think at least another week before I can do that. So I hope everyone had a really good long weekend. Had a long weekend last weekend, at least here in South Australia. And my son just got home from Japan via way of Indonesia. So yeah, he's just been living his best life. And spent 3 months on a working holiday snowboarding. And now he's come back home completely broke and needing to get back to work. So today got a snapshot of where he's working. He's working on a hill overlooking the sea, stuck back into his carpentry apprenticeship. And so, yeah, you can't beat that view for a day at work. So it was nice having him home. We got to catch up and take him up the river, catch up with some friends at the same time. A bit of an interesting day. Like it was a lovely day. And then just as we were kind of pulling back to the boat ramp to pull the boat out, just before that, a jet ski went by, and so we hit a couple of bumps, and my son had his phone in his hand. Just in a flash, it jumped out of his hand and into the river. And yeah, there's no getting that back. So that was a bit of a drama. Got that sorted. Luckily, I've just replaced my phone so I could give him back his old phone, which is the one he gave me when he replaced his phone. So I think he's back in action now. Now, today we're going to finish up talking about supplements. Last time we covered vitamins in general, along with magnesium and calcium, and we talked about that B6 toxicity and how that can happen when people often unknowingly take very high doses of B6 for long periods of time. So these high doses are often found in vitamins. They can have up to, 50 times the daily recommended maximum amount that we're supposed to have. And they can also be snuck into magnesium and zinc supplements. In fact, I recently had a patient who was complaining of those peripheral neuropathy symptoms that we talked about, so the tingling hands and feet. And we had a little chat about what supplement she was taking. And she was taking a magnesium supplement. She'd been taking it for 3 years. We Googled the one that she had, looked at the ingredients, and sure enough, it had a decent amount of B6 in it. So we stopped it straight away. We did the bloods, and it came back 4 times the upper limit of normal. So yeah, she had a B6 toxicity. So the good news is that it is reversible generally. You just need to know about it so that you can stop it. That was interesting, coming right off the back of that discussion in that last podcast. So today we're going to cover a handful more of really commonly asked about supplements. And I'm going to kind of separate them in two. We're going to talk about some anti-inflammatory things I get asked about a lot. And then on the kind of second half, we'll talk more about the things that I get really excited about, like protein and creatine and fiber. So let's start with fish oil, because that's a really commonly asked about supplement. Doc, should I be taking some fish oil? Most people want to know if it's worth taking for their joint aches and pains mainly. But then we also know there has been some talk about prevention of heart disease. From that aspect, is there any good evidence that it can help prevent heart disease? All right, well, let's find out. Let's start first by talking about what fish oil is exactly. So fish oil is an omega-3 fatty acid. I'm sure that you've heard that term, and that is what fish oil is. There are lots of different omega-3s, but the ones we hear most about are alpha linolenic acid, so ALA, you're going to find the shortened version is much easier to say, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. So DHA and EPA are the ones in fish and fish oils and krill oils. So krill are those tiny little shrimp crustacean creatures. This is where you find your DHA and EPA. The DHA and EPA are actually made by microalgae in the sea, and then the fish consume that and it builds up in their tissues, and so that's where we get it. Now the ALA we can only get in our diet, so it's what we call an essential fatty acid. And although the DHA and the EPA can be made from the ALA, so the ALA can be broken down into the DHA and the EPA, we get the majority of those from our diet as well, because apparently our bodies only really make a little bit of DHA and EPA from ALA. So we get most of it from our diet. The ALA comes from plant oils like flaxseed, soybean, canola, and we can also get ALAs from chia seeds and walnuts. Fish with the highest levels of omega-3, so the DHA and the EPA, would be things like salmon, blue-eyed trevella, blue mackerel, herring, canned sardines, canned salmon, and then there are some varieties of canned tuna. Some other good sources would be barramundi, bream, flathead, squid, scallops, and mussels. One serving of fish would be about 100 grams of cooked fish, and the dietary guidelines recommend that we get at least 2 to 3 servings in a week. So why are omega-3s important? Well, they're a part of the membranes that surround every cell in our body. There are high levels found in the retina of our eye, in our brains, and in sperm cells. Omega-3s have lots of different functions. So functions in the heart, in the blood vessels, lungs, immune system, and our endocrine system. And they also give us calories to give our bodies energy. Now, if we're deficient in essential fatty acids in general, we can get rough, scaly skin and dermatitis. So if you're having some skin issues like these, it might be worth having a look at your diet and seeing whether or not you're getting enough fatty acids. Are you eating enough fish? So what is the verdict in terms of fish oil for heart health? Well, there's still a bit of controversy around the effects of omega-3 on the risk of cardiovascular disease. But looking at the various guidelines from both overseas and in Australia, the overall consensus is that having fish and other types of seafood as part of a balanced diet does promote heart health, especially if we're having that in the place of, some other probably less healthy foods, right? So, back to what I keep talking about, the diet is really important, having a good balanced diet. In terms of supplements, there's evidence that fish oil omega-3 supplements can lower triglyceride levels. So triglycerides are a type of fat that we test for. It's found in the circulation. We check that as part of your cholesterol profile because we know that high levels do increase the risk of cardiovascular disease and other things. High triglycerides can be caused by certain medical conditions or medications, but they're often caused by eating too much fat and sugar, not exercising enough, or by drinking too much alcohol. So fish oil can help lower triglycerides, but so can modifying your diet, increasing your exercise, or decreasing your alcohol intake, if any of these are wholly or partly to blame. Now, fish oil doesn't, however, lower our LDL. That's our bad cholesterol. So could help with the triglycerides, but not so much with the bad cholesterol. And again, back to diet. Some good dietary things that you can do to help with your triglycerides if your triglycerides are creeping up. Okay, so overall, it looks like there could be some small benefit from taking fish oil supplements. And especially if you don't eat fish or seafood, then, it's probably a good idea. But like most things, getting it from our diet is going to be considered the best option because, from your diet, you get so many other things along with that nutrient in itself. Now, in terms of joint pain, if you did a quick Google search, you'd probably find that the AI would tell you that yes, fish oil does help with your joint pain. But if you look a little bit deeper and you look at the actual studies and the quality of the studies, you'll find out why organizations like my college, the Royal Australian College of General Practitioners, recommends against it for osteoarthritis because the evidence just isn't there. Now, for rheumatoid arthritis, that could be a different story. There is some evidence that high doses of fish oil might reduce inflammation for these patients, but that really is a discussion you need to have with your rheumatologist if you haven't had that already. In terms of side effects from taking fish oil, they're usually minor, they're uncommon, unpleasant taste, bad breath, heartburn, nausea, that gets some gut discomfort, diarrhea, headaches, and smelly sweat are a couple of others. There is a theoretical bleeding risk, so taking it with other anticoagulant drugs like warfarin or the newer anticoagulant drugs, what we refer to as NOACs, should be discussed with your doctor. So if you're on any of those, make sure your doctor knows so you can have that discussion. And if you're going to have an operation, the surgeon needs to know about it as well. They usually will ask about that before you have your operation. Now, while I'm on the topic of joint pain, I'm just going to quickly also mention glucosamine. It's probably a bit old-fashioned now, but there was a time we were recommending it for everyone. Glucosamine and fish oil for everyone with joint pain, osteoarthritis especially. And so what are we saying now? There is convincing evidence that it does not help either prevent or treat the pain of either rheumatoid or osteoarthritis. And so we just don't recommend it. Okay, so moving on to a kind of a newer one that's popped up over the last few years is turmeric. This is also used for anti-inflammatory type properties, and I get asked about it a fair bit. Turmeric is the spice, and then curcumin is an extract of turmeric. You might have heard of either of these, so you're aware that the curcumin comes from the turmeric, and that curcumin is actually what gives turmeric its yellow color. Apparently, they're both a bit hard to study because they're unstable and they easily change into other substances in the body. Not a lot of them actually reach the bloodstream when you take it orally. So the actions of turmeric and curcumin are not really well understood. When looking at the evidence, there were 3 small randomized control trials, which did find a significant short-term, so somewhere, 6 to 8 weeks, benefits in pain and function. But these are all industry-sponsored trials, so we have to be a little bit suspicious about bias. There were also some inconsistencies in the results, and all of the studies focused on knee arthritis, osteoarthritis, so we don't really know if the effects would be the same for hip or other sites of osteoarthritis. The recommendation by the RACGP is to use caution and advise that we need more research before we can make firm recommendations. There was an article in the August 2023 News GP publication, which is an RACGP publication, where there was a warning from the TGA. We talked about the TGA, the Therapeutic Goods Administration, in our last episode. So they're the regulators of all medications in Australia. The article talked about what the TGA described as a rare but potentially fatal link between consuming turmeric supplements and developing liver problems. The TGA had reported that they received 18 complaints from consumers taking these products that were containing turmeric or curcumin. And one of those reports actually ended in a fatality, and 2 others were classed as severe. They classed the risks as rare, but they just wanted to bring awareness to it. Now, I did have a patient a few years ago who had put herself on a reasonable dose of turmeric over the counter, and she did end up with some liver impairment. But once we stopped it, the liver impairment reversed itself. Just keep that in mind. A lot of these things aren't studied, and we don't really know who is going to be affected, right? So especially if you have any kind of underlying liver conditions, I certainly wouldn't be taking turmeric or curcumin. If it was affecting your liver, things to look out for would be yellowing of your skin or your eyes, if you had dark urine, if you had some nausea, vomiting, unusual tiredness, weakness, stomach or abdominal pain, or if you were experiencing a loss of appetite, then it might be worth considering stopping the turmeric, maybe seeing your doctor. Now, in terms of the risk when you consume turmeric or curcumin through food, there doesn't seem to be the same risk. Are you noticing a theme here? Okay, now I'm going to bridge between here and, as I said, my favorites, the protein, creatine, and fiber. And I just want to talk about ashwagandha. Now, ashwagandha isn't one of the anti-inflammatory ones, but it's kind of in a class of its own. And it is a supplement I get asked about a bit frequently. Ashwagandha has been used for over 3,000 years. It's often referred to as an adaptogen. An adaptogen is a natural substance, so, usually from plants, that enhances the body's ability to adapt to stress. It comes from a shrub that grows in tropical and subtropical areas of Asia, Africa, and Europe. Ashwagandha, the name, is Sanskrit for Ashva, horse, and Ganda, smell, because apparently the roots of the shrub it comes from smells like a wet horse. The species named somnifera comes from the Latin word for sleep-inducing, which is one of the things that I get asked about a lot. Is it going to help with sleep, stress, or anxiety? There have been several randomized placebo-controlled clinical trials, which, as I said before, the best kind of study to have, but most of them had been fairly small in size and short in duration. So that decreases the quality a bit. But these studies have found that ashwagandha looks like it might reduce how people perceive stress and anxiety, and it does also seem to improve both the quality and the duration of sleep. The studies have used different variations of ashwagandha preparations and doses, so it's hard to say which specific extracts or amounts to recommend. Because the studies have been short in duration, we don't really have safety data past 3 months. In those studies, for up to 3 months, it appears reasonably safe. There is some evidence it can affect the thyroid, though, so if you have an overactive thyroid in particular, it's a good idea to make sure that your doctor knows about you taking it so they can keep an eye on that and maybe give you some advice about whether you should be taking it or not. There have also been some reports of adverse effects on the liver with this supplement as well. And again, it was reversible. So once it was stopped, it went back to normal. But again, like any supplement, make sure that your doctor knows that you're taking it. And remember that we don't have any long-term safety data. There's also some literature that suggests that it might not be safe for people with prostate cancer because there's a concern it can actually cause a progression of the cancer. And it's not recommended for those who are breastfeeding or pregnant because there are concerns about birth defects and miscarriage. Okay, now let's talk about my favorites. Let's start with protein. So important that we're getting our protein. If you've been listening to me for any length of time, you know how much I like my protein because it's so important that we are getting enough in our diet. And if we're not able to get it from whole food sources, then absolutely supplementing is a good idea. Now, I've done a whole podcast on protein, so I won't belabor it a couple of episodes ago if you want to have a look. I'll just remind you, though, that most of us are not getting enough. Looking at the literature, there's a big range of what the recommended amount should be, and so I am choosing kind of a mid-range as a target, somewhere between 1.8 to 2 grams per kilogram of body weight, up to 150 grams as a maximum, or around 0.8 to 1 gram per pound of body weight. Unless you have kidney issues, then you need to have a chat with your doctor about what's best for you and work out a target that's specific for you. Now, I just want to talk a little bit about choosing a protein powder and some kind of general information to consider because there's so many options out there, and I didn't really go into that the last time. We talked about plant versus whey-based protein in the protein episode, so again, I won't go into that here. I didn't, though, touch on collagen protein in that episode. I don't think that I was aware of how many proteins are actually collagen-based protein until after that episode. So protein powders made from collagen protein are pretty common, and there's a few things that you need to know about that. Collagen's made from animal skin, bones, and scales, and it has 8 of those 9 essential amino acids that we talked about. So we have to get those from our diet. We can't make them from our body, right? Those 9 essential amino acids. So collagen is missing one, and the one that it's missing is tryptophan. I have a protein water powder that is a collagen-based protein powder, and it has been supplemented with tryptophan to give it all 9 essential amino acids. I have also seen collagen in combination with a whey protein, again, to try to make it more of a complete protein source. One of the downsides to be aware of with collagen powder is that it doesn't have nearly as much leucine as whey protein. So it isn't as good for building muscle as whey is. There is some low-level evidence for bone and skin benefits, and so some people will use it often for its skin benefits. Reduction of wrinkles, rejuvenation of skin, reversal of skin aging, skin hydration elasticity. But again, low-level evidence, but no harm reported, other than some people might experience some gut issues like bloating, cramps, and reflux. I want to touch on a little bit about third-party testing. There have been some reports that there's been some protein powders tested that contained detectable levels of contaminants like heavy metals and BPA, which is a toxic byproduct of plastics manufacturing. There was some controversy over those results, but it is good to keep in mind that no one is routinely testing these products. The manufacturers can do some testing themselves. Some of the more reputable ones will actually have that information on their website if you go and look for it. They can get third-party testing done, and again, you can find that information on their website. Now, third-party testing, at least in Australia, is often just looking for banned substances for competitive athletes, or some of that third-party testing is done to confirm the amount of protein in their product. They're not necessarily looking for heavy metals or anything else, really just the banned substances for athletes. You may see something called HASTA certified, HASTA, short for Human and Supplement Testing in Australia. It's the only lab in Australia that's able to provide independent certification of sports supplements by testing for those prohibited substances. So an athlete doesn't get banned from the sport because that's what they're at risk of if they are positive for these banned substances. Now, if something is HASTA certified, it means that every batch that manufacturer makes is tested and the manufacturing process is checked for quality assurance. Once they're certified, they can have the HASTA seal on their packaging. Again, it doesn't mean they've tested for everything, but they have verified manufacturing quality. HASTA tested means that they've only checked selected batches and the manufacturing process isn't checked. I think the bottom line is to really try to get your protein from whole food sources, like the theme of everything that I talk about. But protein supplementation is certainly an option if or when that's not possible. And when you're looking for a protein powder, look for a reputable brand. Personally, I prefer those that don't have a ton of ingredients listed on the label. Now, just to put the heavy metals into perspective, heavy metals are naturally occurring in the Earth's crusts, in the atmosphere, in the water, like iron and zinc. Those are the ones we need for our health. Things like lead, arsenic, cadmium, mercury, they can be harmful in high amounts. But things like, fish, eggs, and meat, they naturally contain a trace amount of heavy metals. And things like spinach, rice, and root vegetables, dark chocolate, beer, wine, coffee, all contain traces of heavy metals. Traces of heavy metals can exist in lots of things that we eat. So yes, most protein powders are probably going to have a trace of heavy metals, but food regulations ensure that we only have them at safe levels. Provided the manufacturer is adhering to those guidelines, then those levels shouldn't be outside of those ranges. But again, no one's policing it. So unless the company themselves have provided that data for you, you don't really know for sure. Now, the next supplement we're going to talk about is fiber. Another one of my favorites. The lower limit recommended daily intake of fiber for women is 25 grams, closer to 35 for those of us around the midlife period. And then for men, it's around 30 grams a day. About 70% of Australian adults do not meet the recommended fiber intake, and 94% of adults don't eat the recommended amount of fruit and vegetables. 12% don't eat any fruit. That was kind to me in the past. I really didn't eat a lot of fruit. That is one of the things that I have changed for the better and loving it. And then about 1.6% don't eat any vegetables. So there you go. A couple of easy, low-hanging fruit. No pun intended. We know a high fiber diet is associated with a lower risk of colon cancer, breast cancer, heart disease, high blood pressure, type 2 diabetes, and of course, it also helps prevent constipation. And constipation can cause a whole other bunch of issues, like affecting your pelvic floor or hemorrhoids. And I don't know about you. Well, actually, I think I do. I think we're all just that much happier when our bowels are moving regularly and they're moving easily. Now, for me, fiber's been an absolute game changer. As a family doctor, I'm a little bit embarrassed Well, I'm a lot embarrassed to say it, but I'm going to say it because I want to stress how important it is. And I think that if people understand, I thought I was getting enough fiber. And now, that I'm singing from the rooftops to my patients and I'm asking them about fiber, they all think they're getting enough too. And if I have time, I will sit with the patient. I'll ask them what they ate yesterday. We'll go right through it and we'll add up the fiber amount. And I can almost guarantee that most people are not getting enough fiber. In fact, half the amount of what we're supposed to be getting on average, right? It took me a pretty severe menopause to actually take that step back and look at my fiber. It was one of the last levers that I pulled. It was one of the last things that I wanted to look at because I just didn't think that I had a problem with my fiber. When I actually looked at my numbers, I was around 14 grams a day. So probably better than average, but still too low. And I really couldn't believe the difference in my body after doing just this one thing. My gut feels so much better. I always thought I had a sluggish bowel, but no, it turns out I just wasn't getting enough fiber. I was amazed at how many vegetables it takes to get that much fiber. And that's pretty much where I was getting my fiber. And the reason why I thought I was getting enough, because I'm a big vegetable eater. So now I've added more fruits and grains. And in fact, one of the big game changers for me was actually adding that fruit in, cutting back my processed sugar and adding in fruit. And that has just done world of wonders all the way around, especially in terms of just feeling better and, managing my weight. It has been a game changer. Now, we also know that for every 10 grams of fiber that we can increase in our diet, we decrease our relative risk of all-cause mortality. So death by all causes by 10%. So it is worth tracking your fiber intake if you haven't done that already, just to see where you're at. You can do that on a nutrient tracking app like MyFitnessPal, which there's a free version, there's a paid version. You do not need the paid version. The free one will give you all that you need. And just checking in for a few days will give you a really good idea of where you stand. Initially, when I was trying to work out how to get that much fiber into my diet, I did buy some fiber supplements. I found some gummies, and then I also got some Benefiber. And I also have some Metamucil on hand from the good old days. And all of those containers are still reasonably full because I'm pretty proud to say that I've worked it out and I'm getting enough fiber now generally every day in my diet. So yes, I do believe in supplementing if you need to, but getting it from your diet, you'll get all the other benefits of all those colorful fruits and vegetables and grains and seeds. My biggest fiber hack is a bowl of all bran with fruit most mornings. That gets me started with about 13 grams of fiber every morning just to start my day. Now, there are two kinds of dietary fiber, and that's based on their ability to dissolve in water. So there's insoluble, so it doesn't dissolve in water. And in fact, it passes pretty much through your gut, through your digestive system, intact, and it can speed up the intestinal transit time. So how long it takes to get that waste through your bowel. Nuts, beans, whole wheat, barley, and roots, best sources of insoluble dietary fiber. And then we've got soluble or viscous fiber is another thing you may hear it referred to. It does dissolve in water and it makes like a gel-like substance in the gut. So if you've ever had Metamucil, you will know exactly what I'm talking about, or even chia seeds, how they get that really gel-like texture. Soluble fiber can decrease the rate of nutrient absorption, so it can affect the insulin response in a favorable way. It can decrease cholesterol absorption. It can increase satiety, so you have that good feeling of fullness. It also stimulates mucus production, so it's really good for the gut microbiome, so those gut bugs. Soluble fiber has also been shown to be really good for people with diabetes because of that insulin response to control their blood sugar levels. To get those benefits, the recommendation is around 13 grams of soluble fiber in particular per day. So soluble fiber, you can find it in oats, legumes, citrus, muesli, lentils, chia seeds, and fresh fruits and vegetables, just to name a few examples. Now, when you're looking at increasing your fiber intake, I'm going to give you a few tips to help you minimize any gut issues, because that's one of the things that can happen. If you go from 0 to 60 very quickly, you're probably going to have some nasty gut issues. So increase your fiber slowly and spread it across the day. So that can help reduce the excess wind or bloating that can come with increasing your fiber intake. Also drink lots of fluid. So try to get 6 to 8 glasses a day. That can help prevent constipation and can help the stools pass more easily. Start your day off like I do with a high fiber breakfast cereal or rolled oats and porridge or muesli. Add in some fruit. You can throw in some chia seeds, some basil seeds, or even some psyllium husk, which is actually what Metamucil is made of. Chia seeds, basil seeds, fiber supplements, they can also all be added to your smoothies. You can add your lentils or legumes to your salads, soups, casseroles, including vegetables as a snack, making sure that you aim for 5 serves a day. Start pop them into your meals all day, and try to include 2 servings of fruit every day as well. Again, whole foods are best, but there are supplement options if you do need them. And okay, last but not least, I want to talk about creatine. So what is creatine? Well, for starters, it is not a steroid. Most of us, when we hear the word creatine, think about, the big bodybuilder dudes like Arnold Schwarzenegger back in the day. Yes, it is good for muscles, but it's not just for those muscle dudes, right? Let's break it down a bit. Okay, so creatine is a compound that's made in your liver, kidneys, and pancreas. But you also get creatine from foods like red meat and fish, and it's stored in your muscles as something called phosphocreatine. Phosphocreatine is the initial energy source for all of our exercise, and it's what our body likes to use for explosive movements like lifting weights or lifting heavy objects, jumping, short sprints. And this is why creatine supplements are used a lot in strength training, because when we supplement our diet with creatine, we can increase our muscle stores of creatine so we have more immediate energy to lift those heavy weights. And we can increase the amount we lift for longer before we get tired. If you're interested in doing more of a deep dive with creatine, my bestie Suzanne, Dr. Suzanne Rutherford, you would have heard me talk about her before if you've been listening to the podcast. She has a podcast, the Fit Physician podcast, and she did a fabulous creatine podcast episode. It goes into a lot more detail about creatine. So if you really want to nerd out on that, be sure and listen. I'll put the link in the show notes that you can find it easily. The long and short of it is that there is some evidence to support its use for a few different things around this midlife time frame. There's some evidence that can help improve cognitive performance, so it could help with brain fog. It could help with muscle building, and it can also help you have more energy for your workout. So when our estrogen levels decline around this midlife period, we lose the anabolic properties of the estrogen, which means the muscle building properties of the estrogen. And so we have to make up for that in some way. One of those ways would be just in general, the way that you lift your weights. So something called progressive overload, but also one of the things that we can do is supplement with some creatine, which might also help encourage muscle building. Unless the rest of your nutrition is dialed in particular your protein, I wouldn't even consider supplementing, because without the bricks and mortar, that protein, to build your muscles, you can't build them, right? So dial in your protein first, and then you can have a look at the creatine if you want to. The dose of creatine is 3 to 5 grams a day, usually. It can be up to 10 grams a day, especially if you're hoping to get some of those cognitive benefits. You might have heard about people having really high loading doses when they first start creatine. So that's 20 grams a day, which is 4 or 5 gram doses throughout the day for about a week. That's not necessary. It is perfectly fine just to start with the 3 to 5 grams daily. And then over the course of a month or so, it will build up in your muscles and finally saturate your muscle storage of creatine. And then you'll be at a steady state. There can be some water retention, especially more pronounced if you do that big loading dose of 20 grams a day. The water retention is really just in our muscles. Our muscles are just carrying more water, but that generally settles after a few weeks. We can all respond a little bit differently to creatine. There are both what we call low and high or super responders. So low responders, high responders, or super responders, right? One example would be with vegetarians. They're much more likely to respond well to supplementation because they have lower levels in their muscles because they're not eating meat, right? Because the creatine is predominantly found in meat sources. So they're most likely to be the ones who notice the bigger differences. Creatine monohydrate is the best option. It comes in pills, powders, and gummies. It just boils down really to your personal preference. I use it myself. I have a powder. It's inexpensive. I scoop a 5-gram scoop into my coffee every morning. It's tasteless. It dissolves well. I don't even know it's there. And it's perfectly safe for most people. If you have kidney disease, talk to your doctor first before you decide to use it. So there you go, guys. That is the completion of the supplements that I have decided to take a deep dive into. I hope that that's been helpful for you. I know that I always learn a thing or two when I go deeper into these things and update my knowledge in some areas as well, and it's really fun to do. I am, however, very excited to move on, as I always am. If you've been listening to me for a while, you'll know I get bored quite easily, and I'm always kind of moving forward. And so I've got some really fun stuff planned, and so I hope that you'll join me again next time. And if you haven't rated the podcast yet, please head on over and give me a review and a rating. Let me know how I'm going. If you can think of someone who might benefit from this, please pass it along. Have a great week, everyone, and until then, I hope you opt to thrive.
The Opt to Thrive podcast is designed for information purposes only and is not engaged in the giving of medical advice. The information provided on the podcast should not be used for diagnosing or treating a health problem or disease. In no way should the information provided by Opt to Thrive be considered medical advice, and at all times the advice of a medical professional should supersede recommendations from Opt to Thrive. If you have or suspect you may have a health problem, you should consult your healthcare provider. The views expressed in this podcast are purely that of Dr. Sims and do not in any way reflect those of the institutions she contracts for medical services to.
Thank you for listening to Opt to Thrive. If you've enjoyed listening, please rate and share the podcast. You can visit our website at opttothrive.com and leave a comment for any subjects you would like to hear more about.